Dr. N.P. Singh. Being a novel, this corona, I'm talking about corona, being a novel medical issue, there are a lot of speculative reports regarding its connection with diabetics and many other diseases. I'm here today to discuss about steps all diabetics should take regarding control of sugar and also the frequent testing. First and foremost, there are a lot of reports. I think people are already very much aware of like patients with diabetics and other comorbid conditions. They are at high risk of having corona and also more morbidity with corona. So people with diabetics and also other conditions like having high creatinine levels, they are like more than 65, hypertension, heart diseases, previous strokes. So all these are comorbid conditions. All these patients, they are at high corona risk. Okay, but I want to say that don't panic about it. Stay calm. Even if you're having diabetes or any other comorbid conditions, nothing to worry about it. I will be talking about regarding few steps you should take so that you are aware, the chances of having corona are very, very less, and this condition does not bother you much. First, be safe, feel safe, and don't panic. You see, stress and anxiety will affect your sugar levels. Many of you must be knowing that any level of stress, emotional stress, anxiety, it will increase your blood sugar levels. So to keep your blood sugar levels in check, stop worrying too much. And number two, this is also not good for the immune system. Okay, so how to build your immune system, I will discuss. Number two, I will want to say is like you should continue taking medicines in time. Never skip your medicines, okay? And also frequent blood sugar monitoring. Your blood sugar, you should have a glucometer at home. Your sugar should be tested very, very frequently, maybe fasting and also post-pandemic. And another crucial aspect is diets, meals on time, okay? You should avoid high calorie meals and you should take frequent meals like mid snacks in the morning around 11 o'clock and snacks around 5 or 6 p.m. so that your steady level of blood sugar is maintained. All of you, this is a lockdown period and you are at home, so you have temptation to have some unhealthy snacks. Okay, please try to avoid all unhealthy snacks. You can take some healthy snacks, vegetables, then fruits like any fruit at home which is available is good for you, and avoid unhealthy snacks. And number three, I would like to say is regarding the exercise. Don't miss on your exercise. This is very, very important. So you can do at lockdown little amount of exercise. You can do stretching exercise. It's very, very good for you. Stretching exercise. You can do some kind of yoga. Okay, stretching, yoga, meditation. Okay, just a brisk walk around the home or maybe in the terrace or in the garden. Okay, so that this all should include minimum of 30 minutes. Okay, 30-minute exercise is very, very essential. This will keep what is the advantage of exercise? Okay, first it will keep blood sugar levels in control. Number two, sugar will obviously keep your apart from control of the blood sugar, the exercise will keep you happy. Okay, so this is very, very important because with the exercise, the release of certain hormones, we call it endorphins and enkephalins, which literally keeps you happy. Okay, so your mood will be stabilized. We all are prone for, because of the lockdown, we are all prone for stress and strain, and so this way your sugar levels will be controlled, and also you will remain happy. So this is also very, very important, regular exercise. Okay, and also I would like to say that maintenance of sleep hygiene we call it. This is also very, very important. Okay, you must sleep for minimum of 6 to 8 hours. Okay, there are a lot of advantages of a good sleep. Okay, so because of the, you keep on listening some news, a lot of like regarding corona, a lot of people are having this infection and people are dying because of this corona. So you tend to get more into it. Okay, so don't all that get hooked to the TVs most of the time. Okay, see some news and then spend your time in good reading. Okay, you can really have a good time at home. You can spend time with family. You can like do exercise, eating good meals. Okay, and also avoid stressful situations like the news especially. And also with the regarding sleep I was talking, very, very important. If you like just before sleep, if you keep hooked to on your screen, okay, there's a stimulation in your retina, and that will really aggravate your, you won't be able to sleep in time. Okay, so you when you sleep late, you'll get up very late. Okay, so sleep in time and get up also in good time. So in the early morning is very good period for some kind of exercise, yoga, meditation. Okay, so these things should be looked after during this lockdown period. And also you should cooperate with the government. Okay, like lot these are government instructions giving the we should staying at home. This is very, very important. Okay, and also we should follow all the instructions apart from staying away from home. Social distancing is very, very important. Don't, even if you have to go out for some very important work like buying some vegetable or some essential commodities things, you should keep a social distance. Wear a mask always. Okay, and also when frequent hand washing, that is very, very important. Okay, you must know how corona spreads. Okay, it's the most common spread is through droplet infection. Okay, when somebody coughs or sneezes, so you can get the infection. So always wear mask. N95 mask is good for you, or even if that is not available, you can wear simple 3-layered mask. And also frequent touching, you should know how you get the corona. Like one, so avoid frequenting touching of your eyes, mouth and nose. Okay, you can get it through the eyes, through nose, and so you should avoid it. Okay, frequent hand wash. That's why we tell frequent hand washing. And also technique of hand washing, I think you all of you know the frequent technique of hand washing. You should spend minimum 18 seconds to wash your hands, both the front, the other part, all the each and every part of the hands. Proper technique is there, and that you should follow. So I think the for diabetics, the most I should wind up my talk by saying that you should follow all the instructions. Okay, number one instruction for the government: staying at home, social distancing, frequent hand washing. Okay, and also for the better control of sugar. That's very, very important. The sugar level should be monitored. Frequent monitoring of the blood sugar, because you're not seeing your doctors. Like these days telemedicine has been allowed, so you can ask your questions through telemedicine from your doctor, or you can may have some WhatsApp messages. And because that's very, very important. If the sugar levels are very high or low, you should be very alert. You have to decrease your medicine if the levels are coming down, and you have to increase your dose, or your insulin level should be monitored. If the sugar levels are very high, you can even yourself increase the dose of insulin, and you must ask your doctor also. That's very, very important. But because of lockdown, the easy access may not be there. So you should have in fact known, you should have read about your diabetes. Okay, you can read at home. You should know what is the basic levels are there, and how to monitor, how to increase your dose, how to decrease your dose. This is very, very important. And I have told you about the healthy lifestyle. Okay, frequent healthy lifestyle, that means exercise, and also the good meals, avoid heavy snackings. All these things should be there. And also you should follow all the guidelines as laid down by the government. Okay, so at the end I will say, remember, stay at home, stay healthy and stay safe. Thank you very much.